Hi, Chris Coleman here, certified hand therapist for helpforthehand.com, and today we're going to be talking about a condition called Dupuytren's disease. The reason I decided to talk about this condition at this time is because actually watching television lately, I've noticed that they've been having some commercials in regards to this disease, which is something you typically would not see before because it only affects a small population. Dupuytren's disease is actually a condition where a bunching of this tissue here starts to contract and starts to pull, and you first form a little nodule, a little bump that could be painful and sore when things are placed in the hand. A hard object, and soft tissue, and then a hard object being the bone, and then using the hand, it can be sore. And then then it does is it starts to bunch up the tissue and actually starts to pull your fingers down. And then it becomes hard to put your hand in your pocket. It becomes hard to open up your hand if it's sitting like this and to get objects out of it when it pinches. In the past, what has happened is when you have this disease, luckily technology and things have evolved, and that's why you're seeing these commercials now, is because there's actually a much easier treatment for this condition that we didn't see before. Typically what had happened before was these nodules form, and then these cords forms and your fingers started to go down, but the doctors and the surgeons didn't want to go in there and pull that tissue out because inevitably it would keep happening, and it would fix it for a while, but then it would come back and it would get to the point where you'd have to keep going in there. So most physicians had said that until that hand gets where you can't put it in your pocket and it gets so far down, we're not going to go in and operate. Well, now what's happening is that there's a new procedure, and by new I mean within the last decade. It's called Xyloflex. And what they do is they take the cord, that little bunch of tissue in there, and they actually inject it with a medication that has too long a name for me to try and remember. But Xyloflex is the name that they go by. So they inject a cord. In about 24 to 48 hours, you would return to the doctor. The doctor would take those fingers that were bent down and mechanically extend them, thereby breaking the cord or rupturing it. Sometimes you do get a little bit of a skin bleed or a tearing of the tissue there as well. Then typically what happens is you come see a certified hand therapist like me or someone that specializes in the hand. We make you a little splint on the back of your hand or on the front of your hand to hold your fingers straight, and we work on regaining the motion and the strength and taking away the soreness for a couple visits until you're 100%. The old procedure, the bigger procedure, I guess that you would call, where they go in and they take out all that tissue after the fingers have been dropped down here like this, involves opening up the whole hand, dissecting all the tissue out, and it's certainly a much longer recovery and much more of a wound that you have to worry about. So I think the reason you're seeing these commercials now, and I think you're seeing this, is because there's something that we can do about this to make your hand more functional early on, not having to wait till the disease progresses, and giving people a lot more functionality. So a little bit there on Dupuytren's disease. Again, it's from Northern European descent. So if you have that in your bloodlines, and it's typically family members will have it, or my grandmother had it, or my mother had it, my brother had it, and different things like that. It does affect the ring finger mostly, and then the small finger, and then it'll work itself radially along the hand. But typically this is kind of the posture you see in people, and these cords build up. And the reason these cords, essentially don't really know why it does is they just know it's genetic, is that because whatever this tissue is attached to starts to contract and pull that down on it. Imagine if you have your shirt and you pull out and you start to crinkle it up, whatever it's attached to is going to draw in. Same kind of philosophy. So there is something you can do about it now when it starts to, especially if the nodules start to form first and it's tender and sore, they can go ahead and they can do some things now. We don't have to wait until it gets so bad that you have this big procedure at the end. So if you have any questions on this, please feel to reach out to me. You can email me at jchriscoleman@gmail.com, and I'll be certainly happy to help you in any way I can. You can also check out helpforthehand.com, which has not only this topic and some pictures, but some other things as well that can go wrong with your hand. Have a great day.